chronic stress, depression, attention deficit disorder, attention deficit hyperactivity disorder, post-traumatic stress disorder, bipolar disorder, schizophrenia. I, immunity, infection issues, chronic fatigue syndrome, autoimmune issues such as rheumatoid arthritis or multiple sclerosis, untreated infections such as Lyme disease, syphilis, or herpes. N, neurohormone deficiencies, low levels of thyroid, testosterone, males and females, estrogen and progesterone, females, DHEA, dehydroepiandrosterone, high cortisol levels. D, diabetes, diabetes, prediabetes, and obesity. S, sleep issues, chronic insomnia and sleep apnea. The good news is that almost all of these risk factors are either preventable or treatable. Even those that aren't, such as a family history of dementia, can be ameliorated with the right strategies. You need this book if your memory has never been good, and now it's getting worse. Your memory is not as sharp as it was 10 years ago. You're having trouble remembering to take medications or supplements consistently. You frequently misplace your keys or phone. You often wonder why you came into a room. You're embarrassed by forgetting appointments. You read a book or an article but don't remember much of it. You struggle with brain fog. You notice that a loved one's failing memory is interfering with everyday tasks. You are concerned about a family member who has been diagnosed with dementia. You wonder what you can do to avoid Alzheimer's, which has been diagnosed in one or more of your close relatives. As you read Memory Rescue, keep an eye out for the icon on the following page. It will accompany many Bright Minds tips that will help keep your memory strong and reverse problems that may be present. Rest assured, you don't have to do everything at once. Most people are successful when they make one simple change at a time. Once they see how easy it is and how much better they feel, they often make scores of other healthy changes. Bright Minds tip. Loving your brain means treating it with respect and care. Preface. A quote from Marcus Tullius Cicero. Memory is the treasury and guardian of all things. Can you relate to any of these people? Steve, a 60-year-old father and CEO, lost both his father and grandfather to Alzheimer's disease. Steve was terrified he'd get it too, because he noticed his own memory was slipping. Joelle, 42, had no filter. She just said whatever came to her mind, which tended to hurt other people's feelings. Jim, 61, was a very successful businessman who had overcome addictions, as well as growing up with attention deficit disorder and dyslexia. After he got into a bad car accident, his memory became worse, his behavior changed, and he started to engage in habits that nearly cost him his family. Sherman, 71, had been under a great deal of work-related stress for years and had started to struggle with memory, decision-making, and anxiety. He frequently woke up in the middle of the night. Todd, 53, a busy, stressed-out executive, was really struggling with his memory. He frequently misplaced things and hoped it was just part of normal aging. Secretly, he suspected something might be wrong. Sarah, a 62-year-old grandmother of 6, worried because her memory had started to fail. Several months before she came to Amen clinics, she had a mini-stroke that left her transiently paralyzed on her right side. Her faith was critically important to her, and she wanted to pass it on to her grandchildren. However, she was concerned that she wouldn't be able to if she lost her memory. Bud, 52, was concerned about his memory, focus, and energy. His mother had died of Alzheimer's disease, and he had a wife 20 years younger than he was and 2 children, ages 5 and 7. Jasmine, 26, couldn't get out of the funk she had been in for more than a year. She was depressed, anxious, and obsessive. She had to drop out of her PhD program in clinical psychology because she couldn't focus or remember. 5 antidepressants and 3 therapists later,